Good morning to all. Welcome to our next topic on topic number two about medication review in the development of pharmaceutical care plan. So, as we all know, as pharmacists, then we be able to be competent in terms of the skill in developing pharmaceutical care plan for our patient. So, this would be all about pharmaceutical care. The first thing that we be able to do is that we be able to establish a therapeutic relationship to our patient. So there are three main factors that we need to consider then in terms of pharmaceutical care process. One would be in terms of the assessment. Two is all about the development of pharmaceutical care plan. And number three is that we be able to have this evaluation. Okay, so let's move on to number one. So before we going to develop in terms of pharmaceutical care plan, we be able to establish relationship to our patient. No, how to be able to develop this kind of therapeutic relationship to our patient. So you need to be trustworthy, no, and be competent in terms of dealing with your patient. So first of all, if you actually encounter with your patient, you'll be able to introduce your name at the same time your designation. So example, hi, I am Erwin. I am your pharmacist for today. May I help you? So that actually builds actually your credibility to your patient that you are the pharmacist. Okay? Kasi hindi natin ma-distinguish kung pharmacy assistant ba ang nandun sa pharmacy mo or pharmacist ba. Okay? Kagamay sa iyang nameplate, dili na naman nato mahibaw-an if that to be a pharmacist that you're talking with or a pharmacy aide. Okay? So at the same time also, when you talk with your patient, especially in revealing of the data of your patient, you'll be able to say that whatever we mention here, ma'am, the data that you're going to tell me is private and confidential. So you'll be able to situate, no, in terms of your conversation, that everything that you're dealing, the data that you have received and you have interviewed and all of it are actually private and confidential. Okay? So at the same time also, your kind of questioning should be in order, no? So in order wherein, first of all, you'll be able to uh, interview in terms of the medical history of the patient, then moving on to the medication history, then of course, you'll be able to interview also in terms of the social history and other, like example, adherence of the drug, and etc., etc. So it should be an orderly fashion. So in your assessment, you'll be able to ensure that the drug therapy is indicated, effective, and safe and convenient for your patient. No? So what are those assessments or information that you need, no, in terms of delivering pharmaceutical care plan to your patient? You'll be able to also assess in terms of the information, the data that you have gathered then, in terms of past medical history. What are those in the past medical history? Of course, the allergy, no, in terms of the past medical condition of the patient and the current condition of the patient, the chief complaint of the patient, no, and others. Okay? Including of which we have also the medication history, the current medication of the patient, the previous medication of the patient, no? At the same time also the social history that may affect in terms of your medication, and of course any allergy with the drug or the food, and of course the herbal that the patient is taking is part of the medication history. So you'll be able to assess all of this data then so that you may give a correct intervention to your patient. You'll be able to identify also any drug-related problems that associated with his or her medications. Okay? So in your assessment also, usually when I talk with my patient, no, I usually also do, like, for example, blood glucose monitoring, and also blood pressure also monitoring to my patient. When I'm talking with my patient, getting some data, I usually also put, no, some BP set here and then get the blood pressure of my patient. Ano man, because usually psychologically for patient, once you involve this touch to your patient, no, they be able to actually situate na they already have this kind of care to your patient. Diba? Sometimes a doctor actually puts some stethoscope at the back and look at if there's any crackles or any signs and symptoms then of, like, for example, coughing or any in the lungs, no, or no, having fever then, especially with thermometer, or any of the, you know, increase of the glucose and all, with glucose monitoring and all. So this actually services provide us also an assessment to our patient, okay, so that to be able to confirm of any of the assessment that the patient have. Especially, like, for example, the patient went to you and then complaining of lightheadedness and of course a headache, and probably in terms of the increase of the blood pressure then, okay, because of hypertension. So you'll be able to situate the patient to relax first, and then for 5 minutes, and then get a blood pressure, okay, to monitor in terms of the blood pressure. You'll be able to get also the correct data of your patient. At that time, if the patient is, you know, hypertensive or not, malay mo that the patient would have 170 over 100. Okay? There are cases wherein one of my patient in the butika, the patient is having a very high blood pressure. Mura kakuya po na siya. So what we did is that we actually give an emergency medication to the patient, no, in sublingual form, so that the patient will be at ease. Kaya taas kaiyahang blood pressure at that time. So we actually also tell the patient, counsel the patient to relax first in our pharmacy, seated, no, nearby me, and monitor the patient. So in that way, you'll be able to monitor the patient, you'll be able to assess the patient if what is the current condition then of your client. Okay? At the same time also, once you have done all the assessment, whether it is the medical history, the medication history, the social history of the patient, and of course, you've done also your pharmacy services like monitoring of the blood glucose, as simple as that, like glucose monitoring, then you'll be able to give, no, get information, the correct information to your client. Some in the hospital setting, we also do physical assessment. Okay, a normal, like example, reading of the palpitations, reading in terms of, you know, other physical assessment done by a clinical pharmacist. Okay, can also be done also in, you know, in the community setting also. Okay, so after all our interventions of assessment, we'll be able to do care plan. The care plan is actually part of our intervention to be able to resolve drug-related problems, and we'll be able to achieve these therapeutic goals and prevent drug therapy problems. In this care plan, you'll be able to document then the issue, the particular intervention or the action that you want to do, at the same time also the outcome, the goal that you want to happen for your patient. This is the intervention that we're going to give to our client. And this is actually the challenge here in the Philippines, especially in the drugstores or the community pharmacy, wherein there is you know, fast moving of our patient then. At the same time also, this is a challenge for the community pharmacy to deal with pharmaceutical care plan. It's not only in the hospital setting that we do pharmaceutical care plan, but also in the community settings. Okay? And after we have done our interventions, we'll be able to evaluate, is this intervention effective for our patient? Is there any progress then on meeting the therapeutic demand or the therapeutic goal for our patient? Is the outcome achieved? And we'll be able to reassess and reconfirm then of the new methodologies that can be a good intervention for our patients. So there is really a reassessment or reevaluation then. Now, have we achieved in terms of the therapeutic relationship? Do we have a good assessment and data for our patient? Do we have also a good intervention? No? And of course, the meeting, have we met in terms of the therapeutic goal? And all of this in the botica, in the hospital pharmacy then, or as a clinical pharmacist, we'll be able to continue all of this follow up. No? So if you're telling me that you have done pharmaceutical care, I think I would have a goosebumps with this. Why? Because ideally, if you deliver pharmaceutical care services to your client, you'll be able to build relationship. At the same time also, you'll be able to assess, no, in terms of the history and the current medications of your client, develop pharmacy care plan. At the same time, you'll be able to evaluate. And these are all continuous process. But my question here is, in the Philippines, have we done pharmaceutical care plan in the community setting when you buy a certain medication to the certain pharmacy? That's a major question that we really need to develop. No? And as a new breed of pharmacists then in the future, you'll be able to grasp this kind of challenges in the near future, or else we will be terminated or eliminated as a profession. Now, as mentioned last time, that to be able to get the current data as much as possible, obtaining patient medical and drug history, like for example, in the hospital, we have medical records, and in the community, in the hospital setting, we also have interview with our clients or our patient before we give certain medication. I think this is stressed by our new pharmacy law on RA 10918, that to be able to have this medication review, medication history then. And we need to be familiarized on how we deal with patient and interview with patient to get the correct data, the correct information. And we'll be able to assess, is there any drug-related problems? And some of my students will say, oh, there's no drug-related problems. I would always say, go back and reconfirm what you mentioned to me, that there is no drug-related problem. Because as we all know, there are almost 95 to 98% of all medical records and medical prescriptions, medical charts that have this drug-related problem. As we all know, drug-related problem is not only about prescription errors or dispensing errors, but it deals also with a lot of adverse drug reaction, drug-related problems that associated with side effect of the drug, and therapeutic effects that can be also, shall we say, on the other side would be toxic effect for your patient. Okay? So we need really to identify drug-related issues that we need to set priorities of it, of any complaints, any allergy, suffering with your patient in terms of drug-related administration, and we'll be able to counsel our patient and need to have a correct intervention then in designing and implementing a very appropriate, no, intervention for our or plan to our patient. This is all of this are really collaborative. We cannot do it alone. So don't tell me that in your pharmaceutical care plan, you are just alone in your care plan because we say, oh, pharmaceutical, meaning pharmacist. No, pharmaceutical care plan should be collaborative in nature that deals with other healthcare providers. To be able to also inform the prescriber, other healthcare provider, or what you are doing, or what you have, what data have you actually searched on, okay? Because that is the information that you need to give to your healthcare providers. And there are also constant monitoring, not only from your side as a pharmacist, but also by other healthcare providers. And this needs to have appropriate action and follow up then for all healthcare professionals. So as what mentioned last time in our part one of the medication review, it's all about pharmaceutical care process or PCP. In this PCP, I would like to stress out that we be able to develop this kind of relationship so that we be able to proceed to step number one, that is gathering of relevant information to our client. And as what I stressed a while ago, that it involves data on medication history, and of course, our data on medical history, on the records, and initial investigation, whether it's subjective or objective. If that to be chief complaint of the patient of headache, nausea, no, and also tenderness of the gastrointestinal tract, etc. And this data can be actually get from your patient, from your caregiver, some from your general practitioners, even to some of the pharmacists in the community setting. Okay, you'll be able to construct a certain what you call as approach, no, of dealing with this systematically in interviewing with your patient. Then you proceed to step number 228, wherein you'll be able to get information on the indication, the dose, the choice of drug, etc. And you'll be able to reconfirm it with the healthcare professionals, with the textbooks, no? And of course, with the evidence-based journals that we have. Okay? So these are all things that we need to consider then. And correlating it, no, with the data that we have and the evidences would say that, oh, this is actually the the diagnosis of a doctor, which are correct. This is actually the sum of the signs and symptoms that will lead into the certain disease. And we'll be able to identify also, is this a drug-related problem? Is it the side effect associated with the drug? Is it already surpassing the therapeutic index? Is it a narrow therapeutic index? Is it a broad therapeutic index? We'll be able also to ask the healthcare providers on possible consultations that the patient didn't been informed or didn't know or maybe forgotten. We'll be able to discuss on drug-related issues then to our healthcare provider, to our patient then, and we'll be able to propose a solution. So don't call the doctors and other healthcare professionals if you don't have a solution to the problem. And you'll be able to aggressively seek for an acceptance of your solution. Okay? You'll be able to be convincing then of your proposed solution. So it would be useless, your care plan, if it will not be accepted by the healthcare professional. As a drug expert then, and when you're proposing a solution to your healthcare provider or to your medical doctor, they be able to accept your solution to the problem. They need to be convinced, and they need to be ensured that there is a follow-up, that you're going to intervene. It's not a one-time show only. There is a continuous follow-up of these proposed solutions and interventions that you have. And lastly, after your interventions, after your consultation with the doctor and reconfirmation, and of course, acceptance by the doctor of your intervention, you'll be able to have this counseling to your patient. Okay? There always be a collaborative approach. Don't actually mind that patient is just your patient. It is a collaborative approach then. Collaboration means that you'll be able to empower your patient, and that is no, with other healthcare professionals. The focal point or the focal person of your pharmaceutical care process is actually your patient. Okay? Timanin ninyo na that the focal point of our pharmaceutical care process is our patient. And we'll be able to discuss this case number 1. And I'm going to read that Mr. Jones, John Jones, is admitted to the emergency assessment unit at his local hospital complaining of palpitation, breathlessness, and dizziness. He has a 5-day history of some dizziness and palpitation. In the last 24 hours, he complained additionally of shortness of breath. He collapsed at home and was then admitted to the hospital via the emergency department. He experienced similar symptoms 2 months ago, but did not seek medical advice at that time and seemed to recover quickly. On examination and review by admitting doctor, the following information is obtained. Number 1, the previous medical history. There is an hypertension diagnosed 5 years ago, and there is no previous history of cardiovascular disease. The patient is a regular cigarette smoker of more than 20 per day and drinks approximately 20 units of alcohol per week. Drug history is no known allergies, and Mr. Jones had been prescribed lisinopril tablet 20 milligram OD or once a day, but was poorly compliant with the treatment. The signs and symptoms on examination: the blood pressure is 100 over 70 millimeter mercury. The respiratory rate or HR is 175 beats per minute, which is irregular. Respiratory rate is 25 breaths per minute, and no basal crackles in the lungs. And diagnosis is atrial fibrillation. The relevant test result was full blood count, liver function tests, electrolyte and renal function were all normal at the admission and throughout the admission to discharge. Now, my question here is that you are a discharged pharmacist, okay, at that time, and you'll be able to develop this care plan before you're gonna counsel the patient what you're gonna do. So you'll be able to discuss it, how we'll be able to manage this patient. So that's your main question, okay? How you'll be able to manage this patient. Now, first of all, you need to have an initial assessment. You need to know first what are the past medical history and the past medication history then. Is the patient compliant to the medication? What are the risk factors? And as we all know, the risk factors are: first, the patient is non-compliant with the drug lisinopril 20 milligram OD. And since he or she is non-compliant, you'll be able to interview the patient if why is it that the patient is non-compliant to the medication. Is there any of the complaints then? And other significant risk factors in terms of smoking, alcoholism that may reflect into your social history. After you have already done the initial assessment, you'll be able to prioritize what are some of the issues. So you'll be able to start writing, clerking on any of the obtained information, and you'll be able to critically analyze what are some of the relevant issues, identifying relevant issues particularly on this case. You'll be able to say that the main issue here is also non-compliance. The question here is there any potential side effect that the patient may suffering because of non-tolerable side effect that associated with non-compliance and other factors contributing then to non-compliance of the drug. At the same time also, you'll be able to reinforce during the discharge of the patient that there would be a reinforcement of your counseling upon the discharge, because you are in charge as a discharge pharmacist in the hospital setting. Now, we all know that we'll be able to develop the pharmaceutical care plan after you have done the initial assessment, prioritization. Then this is a time for you to develop the PCP. Now, you need to identify the date and the time. Shall we say September 22, 2020, 9:48 a.m. And we identify that some of the issues here are your hypotension, complaining of, blood pressure 100/70, irregular heartbeat of 175 beats per minute, and the shortness of breath of respiratory rate of 25 breaths per minute. And what will be our action? So once you have identified the issue, you don't put it all in the issue. Dapat isa-isa. Okay? In a one row, isa-isa. So that we be able to identify what to be your action of a particular issue. Then we'll be able to check the compliance. Why is it that our action is check the compliance? Because you may actually in doubt that because of this non-compliance, there are a lot of issues that may happen, especially on the potential adverse effects, or perhaps on the non-compliance of taking the medications. And you'll be able to counsel the patient on this, on lifestyle, diet, and compliance on adherence to medication. Now, the main outcome that you have for checking the compliance is that you'll be able to have this controlled blood pressure, heart rate, and respiratory rate. And you'll be able to improve the medication adherence of the patient so that you'll be able to lessen a potential hypotension, irregular heartbeat, and SOB. And lastly, in the outcome of hypotension, irregular heartbeat, and SOB is that you'll be able to inform the doctor of the medication compliance issues of a certain outcome. Now, moving on to this is that we'll be able to have this smoking more than 20, so the social history then of the patient, the alcoholism, and how you'll be able to address that. So the main intervention that we have is the counseling of our patient on the following. Number one is the interaction on medication with the social history of smoking and alcoholism. And we'll be able to reduce alcohol and smoking. So why is it that we don't put here stop? Because at the first place, you are not the grandparents of this patient, or nor the family member of this patient. And we also avoid in terms of withdrawal syndromes associated with smoking and also with alcoholism. So what we're going to do is that you'll be able to say that there are also other services in your hospital or community pharmacy that they may be able to enroll in terms of smoking cessation program and reduction of alcohol intake less than 14 units. Okay? So what will be the outcome? You'll be able to reduce the risk factors, not on smoking and alcoholism, but the risk factors, which is the main problem or the issues. At the same time, you'll be able to monitor on the progress through the smoking cessation program because you are not there you are a discharged pharmacist. Take note. So what you're going to do is that you need to have a referral then to other healthcare providers or even to the pharmacist in charge in the smoking cessation program. So the outcome would be they are going to monitor on the progress through the smoking cessation program. Now, another issue is that the non-compliance of medication, especially lisinopril. Lisinopril is a drug of choice, especially for this kind of situation or condition of your patient, especially if the patient is having hypertension as an ACE inhibitor, okay, which inhibit then in terms of progressing from ACE1 to ACE2, which result then into vasodilation, at the same time increase of your aldosterone. So what would happen then? Okay, in terms of your aldosterone, so that would be lesser in terms of your salt intake. That would be the lesser in terms of your aldosterone level. So in that sense, we be able to say it's a checking in terms of compliance, the intake of lisinopril, 20 milligram OD, and addressing the possible side effect of the drug. And of course, in that sense, the outcome would be to monitor on patient compliance and inform the physician on medication compliance issues. Lastly is that the issue in terms of the follow-up, okay? The lack of follow-up from healthcare providers, especially in the Philippines, wherein sometimes we don't have a time to follow up from the healthcare providers, okay? You'll be able to counsel on the possible med changes and follow up, and of course, referral to the physician. I'm sure that the physicians and other healthcare professionals would love to cater with this patient. This would say that the outcome would be to be able to monitor on patient progress and inform the healthcare provider, especially the physician, on his follow-up, on when would be the next, shall we say, consultation for your patient. Okay, so that would be the possible intervention that we have. So this is all about our pharmaceutical care plan that we always try to consider. No? And after this pharmaceutical care plan, you'll be able to evaluate if your intervention is really effective or not. So I think that's all for your pharmaceutical care plan. Okay, so thank you very much for that. So I'm going to stop my sharing the video. Thank you very much for that.